Annalise Feliciano embarked on her nursing journey 7 years ago with an undeniable passion. She documented special moments, including her very first day on the job.
I could do anything I want to, and that's the beautiful part of nursing.
Today, she's one of thousands of U.S. nurses disillusioned by the profession, feeling burned out by policies that she says prioritize profits and customer service over genuine patient care.
I've worked in emergency department. I've done also ICU. Back 4 years ago, it was a pandemic that we had to go through it, and we had to work very hard. Those conditions have not changed in the part of how do we feel patient safety, our satisfaction, how do we think, the way that we think is we don't feel as appreciated as we should be.
As a result, nurses across several states have staged protests demanding better working conditions.
It was situations that we had 7, 8 patients to one nurse. You have a person that has, I don't know, situations, respiratory issues, while you're having to deal with another one with the blood pressure all over the place. And having to have control on all those things and then like being just you one person trying to split yourself in 8.
The United States is struggling with a nursing shortage. Hospitals have been dealing with the lack of healthcare workers for several years now.
What we're experiencing currently as a workforce staffing crisis in healthcare, where we are losing a lot of professionals working in the field. Many people have decided to early retire or to switch professions and go in different directions.
Factors include inadequate staffing levels, an aging population, and lingering burnout from the pandemic.
We were having cold blues back to back. It could happen. And having to unfortunately people passing away and just going to the next one and then the other one and the other one. And you just think about this is just a mountain that is completely clustering. It keeps building up. Going home with that, you are thinking about you're going back the next day. You bottle those things up, bottling and bottling and bottling until you explode and you forgot. You just think about, it's really hard to lose a patient.
About how many patients did you lose during COVID?
We lost numbers. We just kept working.
I remember reaching out to you and you were saying, I can't do this.
No, I couldn't do it anymore. I mean, I love what I do, but it's heavy. It's heavy.
Annalise no longer works in a hospital setting, instead assisting patients in the private offices of 4 neurosurgeons in South Florida. But she says her depression persists, triggered by years of stressful working conditions.
It's tiring. It's very tiring. Mentally, physically, I lost 20 pounds. I was working, and I forgot to care for myself while I was caring for others.
Research shows that during the pandemic, some 100,000 U.S. nurses left the workforce, and a report by the National Council of State Boards of Nursing found that another 800,000 nurses say they intend to leave the profession by 2027.
We are our patients' advocate, and we don't have advocates for us.
Nitza, Soledad, Perez, CGTN, Miami.